Hi, welcome back to Simply Natural Woman, a channel for women looking for natural health remedies for their bodies. Have you been wondering what natural endometriosis treatments can make a difference in your symptoms? Well, you are not alone. In this video, we explain different treatments to help you learn if they could help with some of the many symptoms women experience with endometriosis. Endometriosis is a medical condition where tissue from the womb grows outside it, causing long-term problems like pelvic pain, painful periods, pain during sex, and infertility. The most prevalent cause of endometriosis, we think, is that it happens when menstrual blood flows back into the body instead of outside as it should do. However, other possible causes have been suggested, and we still need more research to determine why this condition even develops. It's a little complicated to diagnose endometriosis. This usually involves taking a tissue sample from the womb or other parts of the body, typically via a procedure known as a laparoscopy. In some cases, it may take a long time to diagnose. Still, as doctors understand more about the condition, these delays in diagnosis are becoming less frequent. Traditionally, treatment includes taking medication or having surgery. But changing your personal habits may also make a difference for some women, for example, with diet and exercise. The pain associated with endometriosis can be of different types, rising from tissue damage due to inflammation or because of nerves that aren't working properly. And managing the condition through self-help has been found to be helpful. There are alternate or complementary therapies including the TENS machine, certain types of diets, cannabidiol, turmeric, meditation, yoga and acupuncture, which have been studied for their impact on endometriosis pain and symptoms. Half of these studies were related to endometriosis specifically, with varying degrees of evidence showing how effective they were. But women need to have options for treating endometriosis that are safe and easily accessible for looking after the pain and other symptoms, especially if they do not wish to undergo medical or surgical treatments. So let's start our analysis today with the first one, transcutaneous electrical nerve stimulation, otherwise known as TENS. TENS is a way to reduce pain by using a small device that sends electrical signals through the skin. It is used to treat many types of pain, including period pain, long-term or cancer pain, and pain after surgery. The good thing about TENS is that it's easy to use. It also has few risks and you can control it by yourself. You can adjust the strength of the signals to be more comfortable and use it for up to 8 hours at a time every day. TENS has been shown to help reduce pain and the need for pain medication, especially for period pain. It's thought to be generally safe with few side effects. But we do need more research to see if it helps with endometriosis pain and in different groups of women. Next, let's explore our food and diet. Remember, endometriosis is a condition where the lining of the womb grows outside it, causing pain and discomfort. Your diet may play a role in the severity and even the progression of endometriosis, but we don't have too much research around this subject. Eating a balanced diet with nutrient-rich foods and avoiding processed and refined foods may be of benefit. We know certain nutritional deficiencies can lead to metabolic changes which increase your risk of developing endometriosis. Vegetables, legumes, and whole grains that contain nutrients like folic acid, methionine, zinc, vitamin B12, vitamin B6, vitamins A, C, and E may help prevent these negative impacts. And some foods may contribute to developing endometriosis and make the symptoms like pain worse. For example, eating too much red meat, which contains relatively higher amounts of estrogen, can increase inflammation and make the pain worse. Trans fats found in processed foods have also been associated with an increased inflammation and development of endometriosis. Coffee may also be associated with these harmful effects. Some other foods may help prevent and improve the disease. Look out for foods rich in omega-3 fatty acids like fish oil, which has anti-inflammatory effects and may help improve symptoms. Or polyphenol-rich foods like citrus fruits, apples, green tea, olive oil, and dark chocolate are thought to have anti-endometriotic properties. Some studies suggest that increased blood levels of vitamin D and eating more dairy products may be associated with a lower risk of endometriosis, especially when eating in the developing years after puberty. So, diet can be an essential factor in endometriosis. Remember, a balanced diet with nutrient-rich foods and avoiding processed and refined foods can help prevent the negative impacts of the disease. On the other hand, certain foods like red meat and trans fats may worsen symptoms, while omega-3 fatty acids, polyphenols, and vitamin D may improve them. Now, let's look at the third form of natural therapy that may provide some good news if you have endometriosis, and I mean cannabidiol or CBD. CBD is a substance found in cannabis plants that has been favored for its potential health benefits and lack of strong effects on the mood. CBD interacts with a system in your body called the endocannabinoid system, which affects various functions in the body, including how we sense pain and inflammation. CBD can be taken in different ways, such as under the tongue, swallowed by mouth, on the skin, inhaled, inserted vaginally, or sprayed into the mouth. Common side effects of CBD include a reduced appetite, tiredness, problems sleeping, an upset stomach, skin rash, and possible liver damage when taken with other medication. Now, no studies have been done to specifically test the use of CBD for endometriosis pain, but some people with endometriosis have reported significant pain relief when using CBD. Some users and practitioners believe it can be combined with standard medical treatments for endometriosis, but should not replace them. And let's move on to the next therapy, and that's turmeric. Turmeric is a plant that has been used for a long time for medicinal, cosmetic, and dietary purposes. Its primary chemical, curcumin, has been shown to reduce inflammation and positively affect endometriosis in animal studies by reducing certain chemicals in the body known as cytokines. Turmeric can also prevent the growth of new blood vessels, which could affect how endometriosis patches grow in the body. Now, although the benefits of turmeric for patients with endometriosis are not very well described in the literature, we don't know any harmful side effects when you're taking turmeric supplements. And did you know that taking 1,000 milligrams of turmeric every day can provide benefits similar to non-steroidal anti-inflammatory drugs like ibuprofen or naproxen for arthritis? Studies are underway to evaluate curcumin's effects on endometriosis-related pain, and the results may be perfect for women with this condition. And now let's talk about meditation. Meditation is a practice that can improve mental health and quality of life for patients with chronic pain, such as those with endometriosis. Mindfulness-based techniques like deep breathing, guided imagery, hypnotherapy, and progressive relaxation have been effective in improving outcomes in chronic pain. Many patients with chronic pelvic pain have also mental health issues, and treatments that promote mental health like mindfulness meditation holds significant promise. In one study, almost half of Australian women with endometriosis reported using meditation or breathing exercise for self-management. While formal meditation programs where you have to visit a clinic can be time-intensive, you can learn simple mindfulness strategies and implement them into your life and treatment plans. And studies have shown us sustained long-term effects of mindfulness intervention and a better quality of life for patients with chronic pelvic pain and endometriosis. One way is by including mindfulness meditation with other therapy, like women who need to have pelvic floor physical therapy sessions, and this has been shown to improve their pain scores. So overall, involving a mindfulness meditation practice into all your other treatments when you have chronic pelvic pain does have the potential to improve your mental health and quality of life. And next, let's look at yoga. Yoga is an intervention that combines mental and physical aspects for overall health benefits. Another survey of Australian women with endometriosis found that over 30% of them used yoga as part of their treatment with good effects. And a study in Brazil showed women with endometriosis who participated in 90-minute yoga sessions twice a week for 8 weeks developed less daily pain than those who did not. So both Brazilian and Australian ladies reported a better quality of life. We have limited evidence on the safety and effectiveness of yoga for treating or managing endometriosis, but researchers are presently comparing yoga, CBT, and education on quality of life measures to see how these might help women manage this condition better. Next, let's talk about acupuncture, which is becoming more popular as a complementary therapy for endometriosis. Indeed, various techniques have been used, such as acupuncture with or without moxibustion, acupuncture combined with traditional Chinese medicine, warming acupuncture, acupoint catgut embedding, electroacupuncture, and so on. Studies show that between 8 and 22% of endometriosis patients use acupuncture for treatment, and nearly 50% of them found it effective. Many trials have shown the positive effects of acupuncture when it comes to treating endometriosis. In fact, a feasibility study found that acupuncture is safe and effective, and traditional acupuncture methods tend to lead to better outcomes than just a placebo. But we could do with more studies which will tell us if different groups of women will find acupuncture effective or helpful for endometriosis. So we should wait for those results to come through.